Hello, welcome everyone. Let us know if you're here. Welcome to our first interactive 30-minute Navigator update. We have a very special guest. I'm so excited. One of our founding leaders. And
Good morning, everybody. So excited to see you.
There is Amy. Secrets out. Our special guest is, you guys know Dr. Milan, and we're so excited to have you here and roll out this new challenge. But before we get started, my name is Sherry Cisneros, and we decided to try something new this year. And we're going to have these Navigator updates. They're 30-minute interactive, so make sure you can talk. You can unmute to ask questions. This is very much an interactive networking session. So I hope you brought questions because Amy is ready, huh, Dr. Milan? We're so excited to kick off.
I'm super excited.
Our new year, new waiver. We heard your requests for some support with materials to help get some healthcare providers X waivered. So our comms team really stepped up to the challenge. So we're really happy to share our materials. But again, we're going to be meeting in this 30-minute interactive session. So don't be afraid to speak up at any time. This is, just that time to have your questions answered. Remember, if you don't ask it, somebody else is thinking it too. You know that, right? So just wanted to welcome everybody. And I think everybody knows Dr. Amy Milan. If they have not met her, she's one of our founding members of California Bridge and emergency physician at UC Davis. And we are so excited to have you here, Dr. Milan, to kick off 2022.
Thank you. I'm just really excited to be here. So thank you guys for inviting me, and really happy to hear from you and to kind of get to be here with all of our amazing sons. So I just want to say, like, you guys are really you're the ones out there making the change and saving lives and helping people. So huge thank you to you. And I really feel honored to get to spend time with you. So would love to chat, hear stories, answer questions. But it's a new year, it's a new us, and we're going to go out there and crush it. So I'm real excited for this year.
Thank you. So we have our new waiver, new year challenge. Amy, do you want to talk about that challenge?
Yes. So gosh, X Waiver, like the most crazy, complicated, ridiculous thing that could have possibly been invented by the government to make healthcare difficult and inaccessible. We're going to do our very best to push through and bust down those barriers. So remember the changes that happened last year. The X waiver still exists in all of its ridiculousness, but all of the training requirements have been removed. So anyone with a DEA license who can prescribe medications can just go on the website for SAMHSA and register themselves and start prescribing buprenorphine. We actually on YouTube, I have a kind of silly video, 8 hours and 8 minutes. It's kind of cheeky, but spread it around because it's basically, they took that 8-hour training course and we condensed it into 8 minutes, which is all anyone can pay attention to anyway. But there's really no reason to say no, because everybody can go out and just sign themselves up and start prescribing buprenorphine. So that's what we're going to spend this year doing, is getting everybody out there who possibly can registered to start prescribing. Happy to answer questions. So put your questions in the chat, unmute yourself, interrupt me, because I'd love to chat about it. The X waiver, so here's how it kind of works. An X waiver is required to prescribe buprenorphine for opioid use disorder. In the hospital or in the emergency department, there is no requirement. Buprenorphine can be administered to patients for however long they need it without any X waiver. So if someone is admitted for 2 weeks in the hospital, no one needs an X waiver to give them buprenorphine in the hospital. It's just on discharge, they have to have an X waiver. I get a lot of questions about that. Stacey Clark, I love you and I love this challenge. We're going to go out there and crush it. I see your chat.
Definitely. And Amy, if every one of you sons recruits just one healthcare provider, one does not sound like a lot, right? That sounds like one. What's the big deal? But we have almost 160 sites. So if every single one of you, that's a big chunk of new X Waiver providers. So again, that's why we only want to challenge you with one. Let's start off small. You know, if you want to do more,
we're going to go out and make one friend. We're going to change. We're going to do what we do at CA Bridge. We like, you know, save the world one human at a time. And so we're going to go out there and make one friend, make them get X waivered, because it's really a wonderful thing that they can do for themselves and their patients, and do our very best.
Great. We're getting some great, thank you, our comms team. They put the 8 hours and 8 minutes. So that was the one that Dr. Milan was talking about. So we have some questions. We have one from Karen. Go ahead, Karen.
Hi, good morning. Nice to see you again.
Morning.
Hi.
Hi. So I was talking to my ED director today, and she mentioned that the physician has been trying for years now to get X waivered. So I'm new to the program, so maybe things have changed because of COVID. So it will be a lot easier for him to apply now. You just have to register and that's it.
Yes. So it used to be super difficult and ridiculous where you had to take this 8-hour course and send in your 8-hour course. Now you just have to register with SAMHSA. And we have a blog post in addition to my video. So there's all different types of learners that kind of walks through how to hack that SAMHSA website. Once they register, it usually takes about 3 to 4 weeks for them to get their actual X waiver number, which is what they'll need to prescribe. But that's how they do it. If you have someone who's like dedicated and trying to do it, but still struggling, have them reach out to us and we are happy to like walk them through it. But the blog post has a pretty like step-by-step, like write this in this place, send this here. So hopefully that should help them. But there is no educational requirements. So they can just go and sign up on SAMHSA right now. This is important for our EDs, and I want to get some more of your questions, but there's a 30 patient limit. And that does not mean 30 patients in your lifetime. That means like as an ER provider, I can have 30 active prescriptions out there. So if this week I write 30 one-week prescriptions, and the next week I can write another 30 one-week prescriptions because I only have active prescriptions for 30 people. So technically I can write 30 prescriptions once a week, every week, so that my actual total number is pretty high, but it's just 30 active prescriptions at one time. It's really not a barrier for emergency departments.
You know, we get that question all the time, Dr. Milan, about, you know, the 30. So unless they're doing 30 in a day for 1 week, you know, it's really going to be hard. I hope that we can answer some of those questions. Myrna, you have your hand raised.
I do.
Hello and welcome.
Hi, I'm very, very new to the SUN program. I've been with the SUN program maybe about 6 weeks.
Okay.
And so my question is, I understand we only have one waiver in our department, and that's our director. And our patients have been getting turned away and having to go to traveling to other ERs. And when I spoke to my director in the program, she mentioned that a lot of our MDs are kind of against the waiver. How can I get them into it, that how important it is? Because I think each shift needs to have one doctor that is a waiver.
Totally agree with you, 100%. And so what you're experiencing probably is some people who are, you know, have stigma and don't recognize like the benefit of treating people with opioid use disorder. And we kind of have to like get them one person at a time. Tommy knows this, like we had to go through and like get those folks like one person at a time, and it takes a long time, right? We kind of struggle with them, but we will win them. We will win them over. Tommy knows this because we've had some people who like would come up to me and say like, I don't like what you're doing. I don't agree with it. Those are the same people who are prescribing the most buprenorphine today. So you're going to get them. You are going to get them because, you know, we're an inevitable tide, but I don't want to downplay like how hard it is because they have this long stigma. I would start, so if you have one friend, your director who's X waivered, have them help you and say like, hey, have them help you and say, with these patients to let them know like, this is something that we can do. And if that person can talk to them about their successes. The other thing I sometimes will do, and we did this early on, is we celebrated people for what we wished they had done rather than what they've actually done. So I'd send this emails like, we had a patient came in and they did so great. And I really want to thank everybody for providing such wonderful destigmatized care and welcoming this human in and treating them so rapidly. You guys did such a great job and you welcomed them in and you were so kind and you met all their needs rapidly and efficiently. And they were incredibly grateful and they went to clinic and you saved their life. And they would think to themselves, oh, I did that. And that was a good thing. And I'm going to do that. And so then maybe next time they will do what I actually want them to do. But I would spend a lot of time celebrating successes. And sometimes we would celebrate things that didn't actually go right, but what I wish had happened. Because people really respond to, we respond to feedback. And so I would say like, hey, and really kind of highlight, if you have one success, see if you can tell everybody in the department what a wonderful time and how great that person is. Because I think the other thing is, we've seen a lot of, particularly in the ER, we see a lot of how everything goes wrong. And so a lot of times when people are using, what we see in the ED is all of the problems. We don't see the success stories. So sharing those success stories and getting them to realize they can really impact people really makes a big difference. But I hear you, it can be hard. And I just want to say like, I hear you, I feel you, it's a struggle, but you're gonna win this war. Just know it, you're gonna win.
Thank you. Okay, thank you.
Mm-hmm.
So we do have a couple questions in the chat and I don't want to disregard them. So we'll go back to that. And one was, is there any ER physician specific X waiver training? If you missed it, we did put it in the chat. We could put it again. There's an 8 hours and 8-minute training. But Amy, do you want to answer that?
Yeah, so there is, if someone wants to do like an 8-hour training that is ER specific, the American College of Emergency Physicians has an ER specific 8 hours of training. But who wants to do 8 hours of training? And your ER colleagues, like they all have ADHD. I know it, they know it. So that's why we put together an 8-minute YouTube video. And if they see that 8-minute YouTube video and are like, wow, I have more questions, I'm more excited, then we have piles of resources on the CalBridge website and would love to like suck them in and change how they practice. So, if you have someone who wants more training, love it. But we put together, kind of a silly 8-minute video so that they can have fun. And I recognize like half of them aren't going to even pay attention for 8 minutes. They might get through 4. But we could break it up. They could do 4 minutes now and 4 minutes in an hour, and hopefully eventually we'll get there.
I love it. I love it. We also have a question as we have providers that have registered through SAMHSA, but still have not had their X waiver. Has anyone else had this issue?
Oh, really? So they registered with SAMHSA and SAMHSA hasn't gotten back to them? Okay. Yeah. We should get a list of names and call SAMHSA and say, what the hell are you guys doing? Because previously I'd heard they were pretty good at getting people out in 4 weeks. But if this is a problem, it's usually, it's been 45 days, 3 to 4 weeks, maybe they're pushing out to 6. Everybody's out with COVID. I hear it. It was the holidays. SAMHSA's, I don't know what they're doing, but not their jobs. But we need to push them because this is really what they're supposed to be doing, is getting those X waivers out.
Sounds good. So let us know. I know some of you have reached out. I gave you the SAMHSA number because they can send an email or call, but please let us give us your feedback.
I love nothing more than to complain to SAMHSA. I really love it. Like, I love to be able to say like, you're not doing what you said you would. So that would make me really happy.
Great. So now let us know so we can tell Dr. Milan and she's going to advocate for us.
I'm going to complain to them.
And she will do it, you guys. What she says she's going to do. She is 100% committed. We have Tuesday has her hand raised. Tuesday, do you have a question for us? Can you unmute yourself? We cannot hear you.
Oops, sorry.
Hi, Susie. Welcome. Good to see
Hi,
you.
hi, everyone. So I'm actively working at getting our doctors and PAs X-waivered. Could you explain a little bit about the RNs that are eligible to get X-waivered and what kind of sets them apart?
So not an RN, but an NP is eligible to get X waivers. So they have to be a nurse practitioner.
Okay.
You have to be able to prescribe. So anybody who can prescribe can get an X waiver, but a
Okay.
regular RN can't, unless they have a DEA license, they can't prescribe. They have to be able to, like if you could prescribe Norco, you can get an X waiver.
Okay, interesting. So I have some information here. Okay, so do RNs prescribe medication or not very often, right?
No.
No, okay,
No.
or never. Okay,
No.
all right. So, all right, I got a little bit confused, but thank you so much.
No worries. That's a fantastic question.
All right.
Absolutely. We have some
It's
great
super
questions.
confusing.
Yes, that's why we're here. That's why we wanted this forum of, interactive. So remember, if you had that question, somebody else had it too. So always think of that. They're just too shy to let us to want to give that attention. So no worries. We have Karen. Do you want to unmute? Do you have another question? Please.
Yeah.
Keep them coming, you guys. These are great.
So when the NP or physician, once they do the registration and they're in that kind of waiting period, are they able to prescribe in that waiting period, or do they have to wait the 4 or 45 days to prescribe?
You have to actually have the X waiver license number for the pharmacy to authorize the prescription.
Oh, okay.
I mean, if a pharmacy did it without it, great, but the pharmacy is not supposed to. So that's one of the challenges.
Absolutely. You bring up, because yes, they have to put that X on the prescription because then the pharmacies will give it back to the patient. So that's really important. I think we have another hand up. Do I have nobody? I thought I saw somebody.
I had mine up.
Okay, come on.
Okay, give me 1 second. Give me 1 second.
Yeah. Dr. Milan is in the ED working, if for those who don't know. She's a busy gal, but she makes time for us. So I'm really excited about that. But thank you. Such great questions, you guys. Really, keep them coming. That's why we want this interactive. We'll be having this once a month. If it, this is our pilot. So it looks like you guys want this to continue. So Dr. Milan is back.
Sorry, I'm back.
Go ahead.
I had someone ask me yesterday about the 3-day rule. They were confused in the ER that a doctor just got X waivered and said they couldn't prescribe more than 3 days prescription.
Okay,
but I
okay.
explained to him, Dr. Milan, would you like to explain that?
Okay, 3-day rule is for people without an X waiver. So if there's no X waiver, you can come to the ED and we could give you buprenorphine every day for 3 days. Or there's this other 3-day rule, which isn't really happening in California. You could dispense, like put 3 days worth of buprenorphine in a paper bag and give it to that patient to go home. California's got some crazy dispensing California Board of Pharmacy regulations. So we haven't been able to get the to-go buprenorphine, but those are the 2 3-day rules. So the 3-day rule is for people without any X waiver. X waiver, you can prescribe as much as you want for as long as you want, as long as you don't have more than 30 active prescriptions. So the 3-day rule is for people without an X waiver. That's how non-X waiver people can give buprenorphine in the emergency department.
Great questions. We also have, is there a fee for the X waiver?
No. So X waiver is free. It is a huge gift because they, unlike every other license, they don't have to pay for it and they don't even have to renew. It just continues. So it's a one-time free shot. There's no reason not to do it.
Okay, and Troy asks, are we only focusing on getting ED doctors X waivered or the doctors in-house as well?
So everyone should have an X waiver, right? And we all think so. There's no reason, actually the X waiver shouldn't exist, but there's everyone should have an X waiver. So if you find 2 friends, an OB and an ER doctor, 2 is better than 1.
Great. We have Karina and Emerson over at St. Mary's in Long Beach. Hey, welcome. Guys, got a question?
Yeah, hi, can you hear me?
Yes.
Okay, great. Doctor, I have a question. We found a PA in labor and delivery that wants to do the X waiver.
Yep.
Is it a good tactic for us when we're going through the hospital to say, well, labor and delivery did it?
Yep.
So, okay, yeah,
What we did at UC Davis is we X waivered everyone in the emergency department. And then we went around like, shh, the ER is X waivered. What are you guys doing?
Right.
Like family medicine, psychiatry, the ER is X waivered.
right.
So I feel like shame and competition
Exactly.
is a really powerful motivator
Guilt
for
tripping.
adults. Absolutely.
Okay,
Like
perfect.
shaming and calling people out publicly.
I love
it's
it.
a really wonderful strategy, and I highly encourage you to use
I
it.
like that. Nice. All right, thanks.
All right, I have a question from Mary Ann in the chat. We have had to do education to providers about how to write scripts out of the ED for specific health plans, such as Medi-Cal. Can you talk about that?
So buprenorphine is covered by Medi-Cal. And there's no prior authorization for buprenorphine for Medi-Cal. So other than listing their X waiver, they shouldn't have to do anything special.
So Amy, in our county, which is, we have partnership health, for those beneficiaries, the provider has to write, they have to be sublingual strips. They can't be, or else the pharmacy won't fill. And so that when we've had to do physician education for new X waivered, we've had to let them know that in order to get the pharmacy to fill the script.
Oh, okay. Okay, very interesting. They're supposed to be covered based on Medi-Cal, but no partnership is special.
Right, and maybe that county is different. I'm trying to think because, yeah, we don't have to have sublingual. So the next question is the 3-day supply at BUP at discharge.
Okay, so this was a law that was passed last year that says you could dispense, not prescribe, 3 days worth of buprenorphine based on federal law. So it's a federal law that says you could dispense 3 days of buprenorphine. However, in California, it's really hard to do because we are still stuck with California's Board of Pharmacy labeling laws. So it's really logistically challenging for us in California. But there is a federal law that says you could, without an X waiver, take 3 days worth of buprenorphine in a paper bag and hand it to someone. But we still are stuck with Board of Pharmacy rules. And that's why it's tough for us in California.
Okay, thank you for addressing that. Rebecca asked, what about prescribing boot for patients who do not get an induction in the ED because they're not in withdrawal at that time?
Yep, home start's totally fine to do. Yes, absolutely.
And we have
You do need an X waiver to prescribe that.
And we have a protocol on the California Bridge website for that. So to make it easier for the doctor to prescribe. Christine has another question. Sorry if this was already asked, but is it okay for an X waiver physician who isn't on shift to assist colleagues who don't have the waiver?
Yes, we do it all the time.
Okay, we have Medi-Cal is requiring the ICD-10 number and should be ran under brand name, not generic. Okay.
The brand name, not generic, sounds like it is maybe managed care plan specific, but yes, for all medications, Medi-Cal is starting to require ICD-10 codes just to be a pain. Yeah, make our life difficult. But that's for everything. That's not specific to us.
Got it. Okay. And what is an APRN? That's why I am confused. Laugh aloud. That was from Tuesday. Okay, gotcha. That's an advanced practice RN. That's what the AP means before the RN. So there
Okay, thank you.
You're welcome. No worries. Like I said, if you have that question, I know we have over 50 people here that, are here to learn. So no worries.
And I'm learning too. I'm learning that everybody's county has some crazy Medi-Cal restrictions. So
yeah, exactly. Rebecca,
this is why you guys are so needed. I mean, just like right here, this is why you guys are so important, because every county is different and we really, like, every patient is different. And so what we have to do to make it work for each individual person in each individual county, it's really requires like this encyclopedic knowledge that you guys have of your local community and your local regulations. Like, this is why what you do is so crucial and so important, because we need to make the system work for people. And a lot of times it's like we're physically pushing that boulder up a hill and forcing the system to work for someone. And we do it every day, every person. And so it's just why it is so important that you guys are here doing this, saving lives out there. So just want to say kudos and thank you.
I know. Thank you, Dr. Milan. I know you're working, and this really means a lot to our sons. We love these interactive sessions. It just proves that they're needed. So this pilot program that Latoya created and developed is a success. So we're really excited that you came to our initial meeting. We have a couple more questions, you guys, and then I'm just going to give you some updates. Do we have flyers to hang in the ED to remind MDs that can treat patients with but without the waiver? Maybe if more MDs. We don't have specific, but I'm sure we can ask our comms teams. We do have patient face education flyers. So maybe email me directly at cisneros@californiabridge.org, and we can see what we have for you. Artenise asks, what is a reasonable amount of boot that can be prescribed per patient based on appointment availability? This is really huge in our neck of the woods in Southern California, Dr. Milan. So we don't have a lot of clinics, so we're giving prescriptions for numerous weeks. So
yeah, so are we. We
okay.
started, pre-pandemic, we had like this super good 1 week system, and then we defaulted to 2 weeks because it really just takes 2 weeks to get people in. And now we sometimes write a month for people just because it's tough.
Okay. So
whatever it takes, and again, like, it sort of just depends on what you have out there and where your patient is going and what their circumstances are. And we just recognize, like, there's a lot of stuff that gets in the way of getting into clinic. So yeah, we refill, we write for weeks, we do what it takes. That's why we're here.
Okay, well, thank you so much, Dr. Milan. We really appreciate it. I can't even express the gratitude we have for you taking the time out of your busy day, and especially with the COVID surge. Thank you.
Thank you, guys. Great to see you. Thanks for having me.
Thank you. Okay, guys, so we're going to wrap up, and we only have a few announcements. The great announcement is, number one, if you do get a recruit and you recruit a healthcare provider, put your picture on Slack. Let us know, because there's going to be some type of incentive. We'll announce the incentive soon, but it'll be worth your while. So please let us know. And then the other thing is, we have our Sun training. Our normal training will come up January 20th. We're going to put to register in the chat. It is a focus series. We will be having a focus series for engaging special populations with tribal health. If you have not heard their presentation before, it's very meaningful. Really trying to do that community outreach and trying to collaborate with tribal health. I know it's a challenge for some, but we're going to give you some tips and some suggestions, and we're going to have their representatives with us on January 20th. The link is in the chat. And I just really want to thank every one of you for being here. And like I said, we'll see you January 20th and at the next Navigator update. Thank you, guys. Bye.
Thank you. Bye.